All right, welcome everybody. Thank you for joining us for another presentation here with TMC for Seniors. Today we are doing the art of medication management, and we have with us two pharmacy residents who will be letting you know some strategies for safe and effective use with all of your medications. And if you guys are ready, we can go ahead and get started.
Yeah. Hi, everyone. For everyone who has joined us live and all the people who have joined us online, my name is Nazanin Marty. I am a PGY1 pharmacy resident here at Tucson Medical Center. So I am a licensed pharmacist. We're just doing an extra year of training in the hospital setting to just learn more about medications and pharmacy. And I have my co-resident, Mark, and I'll have him introduce himself.
Yeah, my name is Mark Wager. I'm also a postgraduate first-year pharmacy resident working alongside with Nazanin. And what we're doing here at Tucson Medical Center is we're getting additional training and expertise in medication management. And we're happy to be here today and to go over this presentation about managing medication.
I don't know if my hearing's good. Can you guys talk out like just a little notch?
Of course, yeah. It's okay. Well, I'll speak a little louder,
Thank you.
So for today's presentation, like as Mark has said, and also Jennifer, we are going to go over the art of medication management, strategies for safe and effective use of these medications. So the objectives for today's topic is going to be discuss aspects of medication safety as related to older adults. We are going to introduce the Beers criteria and the stop-start tool, which is a tool for improving medication safety. We're going to provide an overview of medications that can cause sedation in older adults and really highlight the significance of understanding these medications' effects on older adults. So why does medication awareness matter? So our older adults are more vulnerable to adverse drug events, and adverse drug events are just any side effects that anyone can experience taking a medication due to physiological changes. So older adults are more prone to those side effects as they age, and we'll go ahead and talk about those physiological changes in the following slides. Also, sedation increases the risk of falls, cognitive decline, and diminished independence. So it's really important to know what medications may cause sedations, to be aware of those medications in order to prevent any of these side effects, such as sedation. So awareness and proper management, of these medications really does improve the overall quality of life. So going into medication safety, as I've said, there are going to be some physiological differences in older adults. As we age, our kidney function decreases, our liver metabolism decreases, and our central nervous system sensitivity increases. So going over each point, so what does decreased liver function really mean? So when we take medications, the liver is the primary organ that metabolizes the medications from its active form, to its inactive form. So when you have, reduced function in the liver, these medications are staying in our body longer. And as we have medications in our body for a longer period of time, we're more prone to those side effects. The same kind of goes with the kidney function. When we have reduced kidney function, we're not eliminating these drugs as much as we would in our body. So again, these drugs are staying in our body longer, again, being more prone to these side effects. For example, if you're taking a medication like diazepam, which is an anti-anxiety medication, if you have reduced renal function, it's going to stay in your body longer. You may experience more sedation from this type of medication. And also increased central nervous system sensitivity. So it really heightens the response to medications that acts on our brain in our older adults. Example, again, older adults experience more profound sedation from any sedating medication like diazepam, which is a anxiolytic medication. And also polypharmacy complications. So older adults often take multiple medications. A lot of you may be on 1, 2, 3, or even more than 4 medications at the same time. So the risk of these interactions together increases. So we really want to know what medications you guys are taking and what the side effects of these medications are, and if the medications you guys are taking have any side effects with each other. Again, medication safety continued. So what are some other medication safety aspects that we look for? Discuss with your providers. Before starting or stopping any medications, you really want to talk with your provider before doing anything. Or even you can go to your local pharmacy and ask your pharmacist, like, what are these interactions? Is there any interactions with this medication? But stopping or starting any medications, this could be your prescription medications, this could be over-the-counter medications, this could be supplementations that you guys take, your multivitamins. So anything that you guys start or stop, you really want to go ahead and talk to your provider to see if it's appropriate to do that. And also, you can use pill organizers. If you have trouble remembering to take your meds, we have little pill boxes. You can buy them at your local pharmacy. It's a really good way to remember to take your daily medications. And also missed dose strategies. A lot of times you may forget your medication. So how do you overcome that? Usually you can take your medication as soon as you've missed a dose. So if you remember your medication was due at 9 o'clock this morning, and if you remember it at 11 o'clock or at noon, it's okay. You can go ahead and take it as soon as you remember it, as long as it's not too close, usually 4 hours to your next dose. So if it's too close to your next dose, you can just hold it and just take your following next dose and just go back on the interval that you were taking these medications. And do not share your medications. These prescription medications are ordered specifically for your health based on your personal factors. This was a discussion between you and your doctor. So this medication is for you based on your health conditions and your prior history. So sharing with other people, it really may have in advance consequences for sharing medications. And also engage your pharmacist. Again, your local community pharmacy, or even us, if you guys want to. We have these events like this. We're always here to help you guys go over your medication lists and answer any questions that you guys have. So moving forward, the first tool that we are going to talk about is the stop-start tool. So what is this? So the stop portion stands for screen tool of older people's prescription, and the start part is screening tool to alert to right treatment. So this is essentially a tool that it's widely used to really enhance medication safety, especially for older adults. It helps your doctor and your provider or any healthcare providers to identify potentially inappropriate medications, and that's the stop part of it. And it recommends medications that should be started if appropriate. That's the start part of it. So for example, let's say you go to your provider and they see your medications that you're taking. You may be taking 2 medications that really does the same thing, and you don't need to be on 2 medications. You can only be on one of them. So this is a tool that can recognize that, and your doctor can go ahead and de-prescribe the one medication, and you can only be on one. So it's a really cool tool to really help your healthcare providers to identify any inappropriate medications that you may be taking, and really initiate appropriate medications that you need to be on. So again, what are some benefits of stop and start? It reduces polypharmacy and appropriate prescribing. And again, I don't remember if I introduced polypharmacy. Again, polypharmacy is if the patient is taking, usually it's more than 5 medications. If an individual is taking more than 5 medications, we'll call that polypharmacy. Stop-start tool really minimizes adverse drug events, and it improves medication adherence and patient outcomes, and it really encourages the use of necessary evidence-based therapies for our patients. And with that, I will go ahead and hand it over to Mark, and he will go present the rest of the
Can I ask you a
Treatment.
question?
Yeah, of course.
Is this an app that doctors use?
So it is like it's in the electronic health system for the providers, so they can go ahead and see what medications you guys are taking, and they can use that. So it's essentially an app that is embedded in the electronic health system for the patient. Like for example, at TMC, we use Epic. There are multiple electronic health systems, and it is an app essentially that they use.
Yeah, thank you, Nazanin. All right, so we talked already about the stop and the start tool, and now we're going to talk about this other one called the Beers tool. The Beers tool, it is a guideline that's put together by the American Geriatric Society to help identify some potentially inappropriate medications for older adults. And the whole point of it is medication safety. We just want to make sure that everyone is staying safe using medications that are appropriate based on body function and the way that the body changes as we get older, as Nazanin talked about. It's to help reduce any kind of adverse drug events and to improve the safety. And the Beers criteria, it focuses on different categories of medications, how they might be beneficial and how they might need to be used with more caution as we get older. And these are based on specific conditions as well. So what we want to do is we're going to talk about some specific categories or some specific conditions for medications. And as we're bringing these up, it's important to keep in mind that these are medications that, remember, they could be potentially inappropriate. That being said, though, you might be on some medications that you've been on for a really long time, and your doctor has deemed like, hey, these are working really well for you, so we're going to keep you going on them. And that is totally fine. It's there's no black and white guideline for everybody. There's no one size fits all. These are just things to be aware of as life goes on. So first we wanted to touch on medications that cause sedation. And a lot of these are really common ones. Nazanin touched on benzodiazepines. These are medications that we sometimes take for anxiety. Also opioids. These are pain medications that you get if you're in a lot of pain, and the typical over-the-counter medications like Tylenol and ibuprofen just aren't working for you, then your doctor might ask you to use some of these. Allergy medications, we all know Benadryl makes us sleepy. Antidepressants as well, because those tend to affect the brain, obviously, then they might cause you to get a little bit sleepy as well. And mood stabilizers too. All of these can affect your level of consciousness and can make you a little bit more sleepy than on average. So these are ones that you're going to want to just use with caution. We did talk about benzodiazepines. I threw up some lists of some common ones. You're welcome to take a look over it and see if you're using any of them. But this list isn't all inclusive. But if they're used at the same time as opioid pain medications, then together they might increase your risk of getting sedated, falling sleepy, and could also cause some breathing issues too. And as such, they can increase risk of confusion, falling, getting fractures when you fall, or causing automobile accidents as well. So big takeaways with this are, if you're not using them already, but then a situation arises where your doctor feels that it is important to prescribe it for you, then follow what your doctor says, but watch carefully to see how it affects you. And so what we generally recommend with that is try to avoid driving, for example, until you see how the medication affects you. And these are also suggestions that aren't necessarily specific to us as we get older, but a lot of them are also generally good recommendations for everybody, no matter how old we are when we start taking these types of medications. And a lot of times there are very good reasons that our doctors want to put us on these medications. And these could be if the benefit outweighs the risk of taking the medication. And some of those situations when they're super beneficial are such as if we're experiencing seizures, severe anxiety, or if we're going in for a procedure. Definitely the risk of not getting an anesthetic for anxiety or sedation would be a lot worse than not getting it at all. Another type of sedating medication are barbiturates. These common ones are like phenobarbital. These ones, just as we get older, can have an increased risk of experiencing an overdose with it. And another type that's really popular is non-benzodiazepine hypnotics. These are ones like Zolpidem, Ambien. These ones can also increase our risk of confusion as we get older. Also, those falling, getting fractures, having car accidents, and also hallucinations too. We actually have a coworker that was taking Ambien, and she reported to us that there was one day that she woke up and she found a bunch of chips and salsa on her bed that she apparently was eating. She just did not remember it at all. And so she stopped taking this medication because she saw that's how it affected her, and she wanted to avoid that going forward, which is a very appropriate action to take. And additionally, with these non-benzo hypnotics, as we get older, studies show that they just don't show that much improvement for sleep, unfortunately. So certainly one to follow up with. And I'm going to turn the time back to Nazanin now. She's going to talk to us a little bit more about these risks of these medications.
All right, thank you, Mark. So now we're going to be talking about the, risks of sedating medications. I feel like Mark and I have already touched base on this, but again, some risks of taking these medications that cause sedation is some physical risks, which include, increased likelihood of falls, and when you fall, the risk of getting fractures increase. There are some cognitive risks, so risks of confusion, memory impairment, and delirium. There's also some respiratory risks, so your breathing, the depression of the respiratory system, especially again, when you're taking medications like opioids, like oxycodone or morphine, with a benzodiazepine like diazepam. These two medications work on the brain, and older adults have a heightened response in their brain as we get older. So taking these two sedating medications really may affect your breathing as well. Again, drug interaction risks, so enhanced sedative effects when you combine oxycodone with alcohol or any other drug that acts on the brain. If you combine it with alcohol, there is going to be a risk of interaction. So now moving forward so what are some strategies to avoid these risks? So a couple of strategies are going to be, regular medication reviews. Involve your pharmacists and your doctors in assessing all your current medications. Start low and go slow. Starting any new medications is always beneficial to really begin the treatment with the lowest dose and really increasing it slowly. We want to start with the lowest dose because you may see benefits with that dose. And if you don't, we can always slowly titrate it up just to avoid any of these adverse effects. The next one is medication education for patients and caregivers. I feel like, such as today, this is an event that we're going over medications. So events like this, it's really helpful for you guys and to know what the medications are and what are some risks for these medications to really for you guys to better understand the risks for the medications that you may be taking. And also implement monitoring and follow-up. So schedule regular check-ins with your provider to go over your medications again. And also use decision support tools. As we've talked about the Beers criteria, you can incorporate that to see what type of medications, if the medications that you're taking are on that list, and what are the risks with taking that medication. And again, with this, I will go ahead and hand it back to Mark.
All right, so now we're going to move on from sedation and start talking about a couple other conditions or types of medications. And as we're going through these, I do want to remind you that we're going to be pointing out medications, but it's important to remember that everything is very patient specific. So I'm going to be talking about general recommendations, but if you find that there's a medication that you're already on and you're like, hey, I've been on that for a really long time, I don't have any problems, that's awesome, that's great. And just following your doctor's specific recommendations for you is really important to keep in mind. What we're going to be talking about are generalized recommendations that the American Geriatric Society has found for adults as we get older. And this first one is a very great example, aspirin. Aspirin is a super, super common medication, and it is great if we're having any kind of cardiovascular conditions where we need to make sure that we prevent the platelets in our blood from clotting together and forming clots that could lead to other more serious conditions. Aspirin is found to be very helpful for that. Now, what the American Geriatric Society has found is that as we get older, if we are not already taking aspirin, then there might be an increased risk of bleeding, which makes sense, right? Because it's preventing clotting from happening. So they recommend that you use it with caution if you have not already been taking it for a while, like before the age of 65 or so, if you are starting it right now. But if you have been using it for a while, or if your doctor has deemed it appropriate for you, then really good recommendation to follow. Just something to keep in mind. Another one, warfarin, super, super popular anticoagulant. Same exact concern by the American Geriatric Society that as we're getting older, then there could be an increased risk in bleeding when we're starting it off. And there are certain conditions where it is the most appropriate medication for, and doctors are aware of that, and they know which ones to prescribe them for. Alternatively, there are other conditions where newer anticoagulants might be more appropriate, such as Eliquis, Xarelto. Those are new ones that are coming out that are found to be a little bit safer on the spectrum compared to warfarin. Then that being said, though, of the newer anticoagulants, rivaroxaban, also known as Xarelto, that is the one that has the highest risk of bleeding. So just ones to watch out for. Similarly, we're going to talk about some blood pressure medications. Tried to list the most common ones that you might see, and again, it's not all inclusive, but dipyridamole, specifically the short-acting version, not the long-acting. and doxazosin, prazosin, terazosin. These are all ones that are found to have an increased risk in what's called orthostatic hypotension. If you haven't heard of that before, that is quite simply when you're sitting down or laying down and then you stand up really quickly, then you might experience a huge drop in blood pressure, and then that can make you feel a little dizzy, a little queasy, and that would increase your risk for falling. So simple strategy to avoid that is just if you are taking those medications, then you'll want to make sure that when you're standing up, maybe do a little bit more slowly. Make sure that you don't have that huge drop in blood pressure. Other ones, clonidine and guanfacine. These ones have that same risk of having that orthostatic hypotension, but they also have the risk of slowing down your heart too. Bradycardia is what that's called. And so those are a couple things to watch out for. And then additionally, there's nifedipine. That's a calcium channel blocker. And similarly to the dipyridamole, we're talking specifically about the immediate release, not the extended version of it. And that one has just been found to cause, in general, low blood pressure, hypotension. And the last condition I wanted to touch on that is cardiovascular related is atrial fibrillation. That is when your heart doesn't quite beat exactly as it otherwise would. So a couple medications that are used to help with that include amiodarone, dronedarone, and digoxin. Very common medications. But as we get older, it's been found that amiodarone might have a little bit greater toxicities than other antiarrhythmics for our heart. But there's always going to be a caveat with everything. They've also found that if you have this atrial fibrillation and also heart failure, then using amiodarone, the risk of using it is outweighed by the benefit. Dronedarone, on the other hand, it's been found that there actually might be worse outcomes if you have that atrial fibrillation and heart failure with reduced ejection fraction. And then finally, for digoxin, they found that it's just generally not as safe as other types of medications for atrial fibrillation and heart failure, especially if you're on higher doses. And you can also experience withdrawal symptoms if you've been on it for a really long time. Moving on, though, we're going to talk about depression, which is also becoming, these medications are becoming increasingly more and more common. Common ones might include amitriptyline, clomipramine, nortriptyline, a lot of tricyclic antidepressants, among others. And in addition to causing that orthostatic hypotension, that low blood pressure when we stand up, they can also increase our risk of feeling drowsy and sleepy and getting sedated too. All right, and Parkinson's disease. This has some medications like haloperidol, quetiapine, also very common medications. Things to be aware of when using these is that as we get older, they can increase our risk of stroke and confusion as well. But the benefits outweigh the risk for a lot of conditions too, like schizophrenia, bipolar disorder, major depressive disorder, and it's also really good. Particularly, we see this in the hospital setting where they're used to help us prevent vomiting. And that's beneficial in that sense because it's used on a short term. It's not used for an extended duration. And then additionally, for dementia, it's helpful for dementia if non-medication behavioral interventions just haven't been proving effective. We also want to touch on an antibiotic called nitrofurantoin or macrobid. Very, very common antibiotic for urinary tract infections. We see it all the time. It does, though, have an increased risk for lung toxicity and liver toxicity, as well as peripheral neuropathy. That's where in your extremities, like your hands and your feet, you might start feeling some tingling or lack of feeling as well. And when this most commonly comes up is if you're experiencing decrease in your kidney function. There are tests that your providers can run to check to see how your kidney function is doing, but a really easy test that you can do at any time at home is just to track how your urination is. If you're finding that you're not peeing as much as you used to, could be a sign that maybe something's up with your kidney. And the reason why that's important for this antibiotic is because antibiotics for urinary tract infections really only work if they can get into your urine or your bladder, your urinary tract. If you're not making that urine, if your kidney function is going down, then how is the antibiotic supposed to work? So just watching out for your kidney function and how much urine you're making as time goes on is really important to do. Okay, we got just a couple more left. These are some really common conditions that we see. Diabetes. Now, the go-to treatment for diabetes is insulin. Insulin is very important. Sometimes our body just stops making insulin. Sometimes our body still makes insulin, but it's just not as effective for our body anymore. And the insulin is, of course, important for managing our blood sugar so that we don't have really high blood sugar rates. The concern with insulin comes up where if we are only taking insulin at mealtime, for diabetes, we want to track our blood sugar. They have devices out there that monitor how our blood sugar is looking, both before or after we eat. And then based on that reading, then we know how much insulin to give ourselves. But there's a risk that is increased as we're getting older if we are only taking it at mealtime. There are different types of insulin, and it's important to try to make sure that we're on a longer acting insulin too. These are insulins that are administered just once or twice a day, usually just in the morning, or there might be a morning and a nighttime dose. These are ones like insulin glargine, Lantus. Those are important just to make sure that it tries to keep our blood sugar at a more steady level. And if we don't have that, if we're only using the shorter acting insulin, like insulin aspart, insulin lispro at those meal times, then there might be an increased risk of it dropping our blood sugar too much all at once. And that is a risk that you don't want to have, because if your blood sugar drops too much all at once, then that can cause some pretty serious side effects and land you in the hospital pretty quickly. So something to talk with your doctor about if you're not already taking one of those longer acting insulins too. Another type of medication for diabetes is sulfonylureas. These are ones like glimepiride, glipizide. These are medications that are oral tablets that you could be taking. And they do also have that risk of hypoglycemia, the causing low blood sugar, and also stroke as well. That being said, though, just as with a lot of the other medications we were talking about, there are benefits that outweigh those risks, such as if there's no other safer option available. And glipizide is the most recommended one out of those. Hypothyroidism, this is where our thyroid isn't working as well. It's been found that desiccated thyroid could cause an increased risk in cardiac events, but there are safer alternatives that are probably a little more common too, like levothyroxine and liothyronine. Stomach acid. So this is the common heartburn that we might be feeling. Really common to use are proton pump inhibitors. These are ones like Protonix, pantoprazole, omeprazole. These ones, if they're used for a really long time, we're talking greater than 8 weeks or so, then you might see an increased risk in a C. diff infection. If you haven't heard of that before, that's an infection that will happen in your intestinal tract where the bacteria will cause you to just have a lot of diarrhea, like so much. And can also increase your risk of pneumonia, as well as, interestingly enough, bone loss and fractures too. But that being said, if you're not taking it for a very long time, or if you're taking it with other medications as a means of trying to protect your gastrointestinal tract, medications that could be more hurtful for your intestines and your stomach, like steroids, non-steroidal anti-inflammatory medications like naproxen, ibuprofen, and also esophagitis as well, the risk would be outweighed by the benefit of this proton pump inhibitor. Nausea, metoclopramide is a commonly used medication, and this one has just been found that there could be an increased risk in involuntary muscle movement, so twitches or other kind of jerking motions that you otherwise wouldn't experience. But it is found to be very beneficial if you're using it for gastroparesis, which is when your intestines aren't moving the food as much as they normally would. It's helpful for that if you're not using it in a long term anyway. Yes?
What's its other name? I don't recognize.
Yeah, Reglan, yeah. Okay, and then saved the best for last, pain. So pain medications we have touched on a little bit already with those opioid pain medications like oxycodone and morphine that can increase sedation. Couple other ones just to watch out for as well are those non-steroidal anti-inflammatory medications. They are over-the-counter medications that don't need to be prescribed by a provider, but when we use them, they can have an increased risk in bleeding in our stomach or intestines. These are ones like really high-dose aspirin, ibuprofen, naproxen, and in addition to the bleeding that it might cause, they can also have an increased risk for peptic ulcers. That's where there are sores that happen in your stomach. They can cause an increase in blood pressure as well as cause injury to your kidneys too. But just as I mentioned on the other slide about the stomach acid, it's helpful if you're taking it with a proton pump inhibitor or misoprostol in order to try to protect your stomach a little bit from these medications. Meperidine is another one of those opioid pain medications that just isn't shown to be as effective as others, and can also increase a risk of central nervous system toxicity, where it might cause some toxicity against your brain. And last but certainly not least are our skeletal muscle relaxants. These can be ones like carisoprodol or methocarbamol. These ones, in addition to causing an increased risk in sedation, as they do for everybody, they can also increase our risk of fractures as well if we lose our balance and fall down. And with that being said, I'm going to turn the time back now to Ms. Nazanin to talk about other medications that we might be able to look to use instead.
All right, thank you. So to finish off the presentation for today, let's talk about some safer alternatives now. So what are some safer alternatives for anxiety and insomnia? Well, one is a non-medication therapy, so it's cognitive behavioral therapy. Could be, good for anxiety and insomnia, or some non-sedating medication like buspirone or melatonin, which is sold over the counter to help you with insomnia. And also sleep hygiene strategies. So consistent sleep schedule, avoiding stimulants before bedtime, not drinking a cup of coffee a couple hours before bedtime. Just practicing those strategies can help you with anxiety and insomnia. Going into pain. So what are some safer alternatives? We have over-the-counter Tylenol, which is safer, NSAIDs, as Mark has told us about, like ibuprofen and naproxen. They do increase the risk of, fractures, peptic ulcers. So Tylenol is a safer option. There's some topical analgesics. We have patches, ointments, creams available that you guys can use instead of medications that are taken by the mouth. And also physical therapy. The good old-fashioned physical therapy is great for pain management. And also some non-opioid pharmacologic options like gabapentin. Medication is usually for peripheral neuropathy. As Mark has said, that's you have tingling sensations or lack of sensation in your extremities. And also for allergies. So we kind of have two generations of antihistamines. We have first generations and second generations. So first generation antihistamines are like Benadryl. And as we know, Benadryl does cause sedation. So a safer alternative would be second generation antihistamines like loratadine, cetirizine. These medications, the risk of sedation are much, much lower than the first generations like Benadryl. And Flonase and saline nasal sprays for congestions are all safer options for allergies. And just finishing up the presentation, so our the key takeaways for today. So older adults are highly susceptible to sedation-related adverse effects. We have introduced the beers and the stop-start tool. These are tools for safer prescribing. And again, we really want to emphasize regular medication reviews, medication education, and alternative therapies to improve outcomes. And just collaboration between, healthcare professionals, patients, us with you guys, answering you guys' question to just ensure safety and, increase safety. And thank you guys for joining us today, for our in-person audience and anyone with us online. And me and Mark would be more than happy to take any questions that you guys may have. Thank you.
All right, I have a couple that came in from online. The first one is, are there any common medications that might have a drug interaction that can be dangerous that most people don't realize could have a drug interaction?
Again, there are a lot of drug interactions that really we would have to go ahead and go over like the list of the medications that the patient is taking to see. But for some common ones, I think I've touched based on, if you're taking an over-the-counter Benadryl and if you have a prescription for oxycodone, again, those two medications can really amplify the risk of sedation. So those are maybe the most common one. Or if you're taking oxycodone and you're drinking alcohol, again, that does depress our central nervous system. That can cause for sedation or respiratory depression. But again, going over the specific medication list of each patient, that's the most important part. You really have to see what each person is taking to see what the interactions could be. Because sometimes there are interactions, but they're not life or death. It's just something that you just need to be aware of.
Yeah, and I really like what Nazanin was pointing out there, how she was giving examples of there are prescription medications that our doctors have given us, and then there are over-the-counter medications, or even not medications at all. They could be food or drinks that might cause these interactions. So that's why we wanted to emphasize that before you start taking any kind of new medications, whether they be over-the-counter medications, whether they be nutritional or herbal supplements, to check with your doctor, check with your pharmacist, make sure that there isn't anything else. Like another one, we like to drink grapefruit juice, but oddly enough, you wouldn't necessarily think this, but grapefruit juice can cause a lot of interactions with a lot of different medications. So watching out for things like those.
And that kind of goes into the next question, which is if you wanted to talk to your pharmacist or a pharmacist about your medication list, how would you go about scheduling that or setting that up?
To just relay. So we offer MTM services at our outpatient pharmacy, so just repeat that into that. And then just work with your pharmacist wherever you fill your medications to set up time too. Or we're available after the presentation too.
Yeah, I just want to go ahead and say what Sam said so our audience online can hear us. Our outpatient pharmacy at Tucson Medical Center, we do offer MTM, which stands for Medication Therapy Management. So those are, you can always go make an appointment for our pharmacist to go ahead and go over your medications to see, any risks. It's just a medication management. And also your local pharmacy, you can always go ahead and go to the consultation window and ask them about any questions that you guys have. Or you can always call them beforehand to say, hey, what is a good time? What time are you guys the least busy so I can come in and just ask you a couple of questions about medications? I worked at a community pharmacy and I did that all the time, and I'm sure they will be more than happy to do that. And of course, we are here after this presentation, so please, any questions will be available after this talk to answer for you guys.
All right, thank you both very much. And thank you to everyone who attended online as well.